All right, thank you for coming and watching this online. My name is Julie Cutright, and I work at the Wood County Health Department.
And my name is Ashley Normanton. I also work at the Wood County Health Department.
And we're here to talk to you today about the Community Health Assessment, also known as the CHA. So throughout this presentation, you're going to be hearing CHA. So when you hear CHA, think it's the Community Health Assessment. So I just kind of wanted to give a brief outline of what we're going to talk about today. Who Healthy Peoplewood County is, because we're the ones that, as a collaborative effort to work on it, and the 4 key principles that guide Healthy Peoplewood County, the social determinants of health, health equity, what the community health assessment is, the process, the results, and then what the results were, the top 3 health priorities, and what the community health improvement plan is, CHIP. So we have the what, and then how are we going to do it. So a little bit of background, Healthy Peoplewood County. So Healthy Peoplewood County is a collaborative effort, and the CHA was written with the health department staff, Aspirus staff, and Marshfield Clinic staff. So it was a group of us that worked on this. It wasn't just the health department. The CHA is the same for the health department, Aspirus, and Marshfield Clinic health systems. The only thing that really differences is our community health improvement plan and their implementation strategies. But those are informed by the community health assessment. So why we exist is because it's a statute that there has to be someone working on the community health, and also it keeps the health department accredited, and it is supported by many people who work and live in this community. So our guiding principles are we work on health equity. It informs what we do. We look at the social determinants of health, community engagement. So a lot of community engagement went into the community health assessment, which I will talk about when we get to the process. Policy, systems, and environment, thinking about how can we build a world that helps people be healthy rather than just doing blanketed education. And so the social determinants of health, think of it as like housing, access to care. Think about everything outside the doctor's office. So where you live, do you have access to a vehicle to get to work? How do you get places? Think about where you live in proportion to like grocery stores and things like that. And then we have and also the social determinants of health were talked about in a previous luncheon and learn by Christy Egge of the health department. So please feel free to go back and look at that for a more in-depth understanding of the social determinants of health, as well as health equity. So equality is everybody getting the same thing. Equity is about fairness and everybody gets what they need. So this is a really great example. So a handicap accessible bike, he's too tall for this one, so he gets a bigger one, so on and so forth. So what is the CHA? So as we have some background on like what kind of guides our work, so what is the CHA? It is a comprehensive health assessment. So we go into the community and it's led by Healthy Peoplewood County, the health department, Marshfield Clinic, Aspirus, and we go out into the community and we conduct surveys. We have focus groups, also known as community conversations. We also did key inform interviews. So this is like community input was the primary data that was collected. So through the surveys, we had 874 completed surveys, but we also had incomplete surveys that influenced what were chosen. Focus groups, we did them at the ADRC, the Boys and Girls Club for the youth, the Hmong community, River Cities Clubhouse, and we did the Wisconsin Rapids YMCA, and we also talked to WIC participants. And these are all of the key informant interviews we did. So we talked to a person from all of these organizations, the school districts, a bank, the United Way. So we also didn't just focus on Southwood County, this is for the whole county. So we talked to people from South, the North, the Middle. So the top 3 health priorities that were chosen and that are going to be talked about are substance use, behavioral health, and active community and community food systems. So They're pretty self-explanatory, but we're going to get into the depths on why they were chosen, the data that was used for those, and what informed that. That way, we didn't just pick them, but rather the community did. So Ashley's going to talk about the first one.
So again, I'm Ashley Normanton. I'm going to talk about substance use. So part of my role at the health department is substance use prevention, focusing on that specifically for Wood County. So we address the topic of substance use through a team called the AOD Prevention Partnership. So under Healthy People Wood County, that's one of the groups that exists to address the top health priorities that were identified through the community health assessment process. So I just want to make sure I'm going the right way here. Some of the primary data that we collected kind of shows that substance use was the #1 health priority that came up across the board. So through those community conversations, those focus groups, and through the survey, substance use came up the most often. Some of the secondary data that we collected is shown on these next couple slides, and we do have a lot of text on these slides. I also just want to point out that a lot of this information is taken directly from the actual Wood County Community Health Assessment. So this information will be found once we publish our Community Health Assessment. It'll be found on the Health Department's website, so we can direct you there if you want to find out more information about any of this. So the first thing that we looked at for substance use is alcohol, and obviously Wisconsin has an issue with alcohol use and abuse. So through the prevention work, we know that the longer we delay youth substance use, the better health outcomes they're going to have. So they are going to be less likely to develop a substance use disorder if we delay some of the alcohol use, tobacco use, marijuana use until later and later. We understand that the brain doesn't fully develop until around the age 25-ish, around there. So if we can delay that use as far out as we can, our drinking age is 21, even though the brain doesn't stop developing until 25, that's another issue we have. But nationwide, that drinking age has got to be 21. So just looking at ways that we can delay that use is what we look at in our community health improvement plan later on. So that's not included in this, it's included in our CHIP, the Community Health Improvement Plan. One of the things on here that I can talk a little bit more about is in 2015, Wood County ranked 8th among Wisconsin counties for alcohol-related misuse indicators. So those indicators were alcohol-related deaths, hospitalizations, traffic crashes, and fatalities. And some more data on substance use. This is youth substance use for alcohol. And as you can see on the graph, those numbers are declining for binge drinking past 30 days and then at least one drink in the past 30 days. I think that was cut off, or no, at least one drink in their life. So underage drinking is nationwide, it's declining, but that doesn't mean we can stop addressing underage drinking, because it is still the #1 substance that is misused by youth. It's still obviously a huge issue in Wisconsin especially. The problem isn't going away. If we lose focus of underage drinking, it may very likely go up again. So the next one here is tobacco and nicotine delivery products. That includes e-cigarettes and vaping. You may have heard of that term. That's kind of a big one. So in 2018, we found that 1 in 5 high school students reported ever using e-cigarettes, and that's not just for Wood County, that's a national statistic. And then in 2019, this is the Youth Risk Behavior Survey data, so this is let me see, it got cut off on there, 2015 and 2017, you can see there's a sharp decline in self-reported Youth Risk Behavior Survey data. That survey is supposed to be anonymous for students, and so they feel comfortable saying what they've ever done. And that number declined quite a bit, but in the 2019 data, which we don't have put in the report yet since it just recently came out, that number is actually up closer to that 22%. I believe it's around the 21% again. So it may look like the use of e-cigarettes went down in Wood County, but it actually is back up right where it was, if not higher than that. So then we get into marijuana. The biggest issue we see here in Wood County is that youth do not perceive marijuana as a risky substance. And that's kind of a national trend with the normalization of marijuana that's happening in these communities. People don't think it's risky. They think, oh, there's medical marijuana, so it's a medicine, it's safe to use. And so youth don't see harm in using that. But again, with the brain development going on at that early age, they are more likely to try other substances if they are using some of these substances that are affecting their brain chemistry. Then we get into opioids, and opioids include both prescription opioids as well as illicit drugs. So some of those prescription opioids can be your Oxycontin, your Vicodin. Fentanyl is actually also a prescription opioid that can also obviously be an illicit substance if it's not used as prescribed. And that is the substance that is being cut into these other drugs, and we're seeing all kinds of overdose deaths related to fentanyl. Your other illegal opiates can be like your heroin, for example. We also have information about naloxone on this slide, and naloxone is that opioid overdose reversal medication that can be administered. And I did just want to point out that naloxone administered during ambulance runs has increased over the years, not only due to the increase in opioids available or opioids that are being used because someone is addicted to those substances, but also if you may have those cases, you may have an elderly person who couldn't remember if they took their medication or not. So they may be overdosing, and we can administer naloxone in that case. There could be young kids in your home and they get into your medicine and accidentally overdose. So a lot of the accidental overdoses require naloxone to be administered as well. So it's not just the illicit use of those opioids. So I'm not getting a lot into the numbers here. We have the Wood County in the green and the Wisconsin data in the blue, but I will let folks look a little bit closer at that if they're interested. Some of the work that we do at the local level related to the opiate use and other illicit drug use, we have been working closely with the Wood County Jail actually to reduce recidivism rates. And we're hearing from all kinds of folks that why are we keeping these people in jail and just rearresting them? They're let out, we arrest them again for the same issues. And the conversation is we need to get these folks into treatment. We need mental health treatment, we need substance use treatment. Putting them in jail isn't really helping the county as a whole. It's not helping the jail, obviously, with the overcrowding. So those conversations are happening right now. Next, I'm going to talk a little bit about behavioral health. And my coworker at the health department, David Strong, leads the Mental Health Matters team. So this is some of the stuff that they focus on. So behavioral health was the second highest priority identified through the community health assessment process. So you can kind of see how many times that came up in conversations. And then we have mental illness among adults. With that, you can use the old analogy, what came first, the chicken or the egg? Substance use, does that cause the mental illness? Does the mental illness lead to substance use? That's the analogy that I like to use for adult mental illness. So also in risky behavior, suicidal ideation, things like that. Mental illness among children is severe mental health issues among children, maybe directly associated with trauma they had experienced in their life. That is known as Adverse Childhood Experiences, or ACEs. There's a whole survey that you can take to see how many adverse childhood experiences you've had in your life, to see, and that kind of indicates what some later health indicators are. So some of the secondary data, mental illness is highest among marginalized population, and that's what this graph shows. So again, working with that Wood County Jail to reduce recidivism rates is one of the things that we're doing with this information. And then we have percentage of Wood County adults with a mental illness by service type in 2017. So are people being served who are living with a mental illness? So without access to treatment, healthy coping skills, and resilience, people living with mental illness may experience more frequent hospitalizations, co-occurring chronic diseases, higher risk of continued suicide, and overall shorter life expectancies. And then the suicidal behavior in Wood County high school students by year. This is more of the youth risk behavior survey that I talked about earlier. So 2015 is shown in the blue, and the green is the 2017. And again, we'll soon be able to add that 2019 information. So the first one there is suicide intent. The middle one is suicide attempts. And the last one, suicide attempts resulting in hospitalization. And that was all self-reported information by the students. I'm going to hand it back over to Julie to talk about active communities and community food systems.
All right, I'm back to talk about the active communities and community food systems. So this coalition is Recreate Health, which is led by our coworker Sarah Saluski. So I will be talking mostly in broad terms about the data that we collected. I can't get into super specifics about the work being done. So this was a third most determined health issue, but this includes chronic diseases, cancers, access to environments where people can like walk, be healthy, and also access to like healthy foods. So this all encompasses that. So 61% of participants believe health access increasing increasing physical activity is very serious, so people need to do that. And then 34% of survey participants agreed that there is access to healthy food. So I'm going to talk briefly about the obesity and other chronic diseases, but this coalition really focuses on the policy level, the systems level, and the environmental level. Kind of the best example I can give for the environmental level that this coalition has done is the bike share program that you see in Wisconsin Rapids, Zagster bikes. I can't give a lot of detail on that, but we have found that people in Wisconsin Rapids really enjoy it, especially when they go down the trails, down the rivers, and also around the lake. So heart disease is something we talked about, so there's more detailed statistics about heart disease in the community health assessment. Also, heart disease is contributed to obesity as well as like unhealthy eating, but there's also a social, economic, cultural component, which is those social determinants of health that we talked about earlier. Diabetes, obesity is leading cause of type 2 diabetes. And then also I want to mention that the top cancers in Wood County are lung, breast, and prostate, and colon cancer. I also want to talk about obesity and how it can be related to people's income. We talk about this a little bit more in depth in the community health assessment, but about how your income increases, obesity decreases because you have more access to healthier foods and you can buy stuff, you can afford memberships to gyms and so on and so forth. And we're also where people live impacts them. There's that social community, the social determinants of health and the health equity piece again. So if you live in a neighborhood where the sidewalks aren't good or it's not well lit or you don't feel safe walking, that can increase like obesity because you just don't have access to the physical activity that someone else might. I really want to focus on the health and on the food insecurity aspect of this. There is also more information about this in the community health assessment, but healthy eating can reduce your risks of chronic diseases, but food insecurity is the inability to access. I just kind of want to point out this statistic about Wood County is 809 square miles, but there's only one grocery store per 400 square miles. So that's only 1.5 grocery stores per 10,000 people. It's not a great statistic, especially if you compare it to probably the number of bars. So kind of thinking about it that way. Also, food insecurity contributes to chronic diseases and other health problems because it reduces your ability to get your fresh fruits and your fresh vegetables. And in Wood County, 72% of food insecure homes are below 200% of the federal poverty rate, and they're likely qualify for SNAP or food share. So kind of talking about food share, it's a program that was created to help people gain access to foods. Participation decreased, but there's also kind of an important component that we talk about in the community health assessment that it probably isn't, there's some like policies that impacted that, rather than people all of a sudden have access to food, they can pay for it, but there are some policy implications to that. It is also important to note that hunger relief services continue to experience increased rates of like they need to have more food on hand, they need to have provide more hot meals for people. So whereas we're seeing food share numbers go down, but we're also seeing an increased rate of that. I also want to talk about free and reduced lunch here in Wood County. So South Wood County has a higher rate of free and reduced lunch than Northwood County, but that doesn't necessarily mean that Northwood County is doing a good job because their rates went up as well. So we're seeing it on both ends of the county that children are needing access to free and reduced lunch. There has been quite a uptick, and this is from the DPI website. I also kind of want to point out that Wisconsin Rapids has 4 schools that 100% of their student body qualify. I also want to talk about women, infants, and children a little bit. So this is over at the health department. So this is a supplement program as well. We're seeing there has been a decrease of like adult participants, but a greater increase of child participants. We talked about this more in detail as well in the community health assessment. So we talked about the 3 top health priorities: substance use, behavioral health, and active communities and food systems. But that is basically the research that's going into our community health improvement plan. So that is the research that backs what we're going to do about it. So the CHA informs the community health improvement plan. So the community health improvement plan is goals, objectives, and activities to hopefully impact in a positive way those top 3 health priorities. And we're in the process currently, and we've had 10 community conversations to get feedback. Well, we've had almost 10. We're finishing up this week. Community conversations about what the community thinks about our plan. Do they think it's going to work? We're getting a lot of great feedback and ideas to help improve, and very community-based, much like the community health assessment. So like Ashley had mentioned, there are 3 teams that work on this: CAOD Prevention Partnership, Mental Health Matters, and Recreate Health. If you are interested in being on any of these teams, please reach out to anyone of Ashley or I, but also David Strong for the Mental Health Matters and Sarah Soluski for the Recreate Health. And you can get more information about Healthy People Wood County on healthypeoplewoodcounty.org. Thank you.